Well, the healthcare crisis did not end with the passage of the federal reforms last year. What that really did was mandate that people buy private health insurance. And private health insurance eats up about a third of every dollar we spend on our health care. So we didn't solve the problem of costs. There are no cost controls in this thing. Access becomes an issue. It's going to be cheaper for a lot of people to pay the tax penalty than to buy this very expensive insurance on the private market if they're not covered by a group plan. And we didn't improve some of the problems in the healthcare systems, like the shortage of primary doctors. There's nothing in this bill that really does much about that. Or the unequal distribution of health care resources between urban and rural areas and different urban neighborhoods. So we still have to solve this healthcare crisis, and above all, the costs. If you look at the cost curves, it's going to cannibalize the rest of the economy if we don't do something about it. And the solution's always been there on the table. It's called single-payer, publicly financed health care for all. And there was a study done in New York State, mandated by the legislature, contracted by the Departments of Insurance and the Department of Health, and done by the Urban Institute for the state, and reported out in July 2009. And it showed that New Yorkers would save $28 billion a year by 2019 if we adopted a single-payer plan over the individual mandate plan that the feds adopted. So we know a single-payer plan will save us money in New York. Single-payer would provide everybody with comprehensive coverage with no out-of-pocket expenses. It would be paid for by payroll tax and other progressive taxes. And like I said, comprehensive benefits, including dental, mental, and your regular medical care, optical care as well. And everybody be in, nobody be out. That spreads the costs out. That's why it's cheaper. The overhead cost for Medicare, which is a single-payer system for people over 65, is about 3% compared to 31% for the private health insurance industry. That's where the savings are. And with those savings, we can insure everybody and give everybody top-of-the-line coverage. And that's what we got to do. New York should set the example. California is on the verge of passing the bill. Pennsylvania is on the verge of passing the bill. We've got a lot of support in the state legislature, but the governor is not behind it. Patterson shelved it. Cuomo hasn't said a word about it. The Green Party's for it, and that's one other reason why people should vote for the Green Party.